one of the key goal of MAP is to pick up new technologies and envision and provide a framework or a path forward to apply these technologies to patients. Of course, the first one was immunohistochemistry. Then we had genomics more recently. So how to move genomics to patient? So there are 3 questions here. First, we need to have prospective clinical trials that validate each genomic alteration. So that is the first thing. Second, we need simple technologies that can be done for low cost. Because of course, globally, we cannot afford having too expensive technologies. Second point. Third point, for the future, we need to be able, thanks to modeling and artificial intelligence, we need to be able, from one high throughput genomic analysis to model the biology of cancer for each patient. MAP conference should be attended by clinicians who want to understand translational research, and should be attended by our colleagues making basic science who want to apply their work to clinics. So it's a typical conference that is at the interface and that is multidisciplinary.